Well, just a few hours ago, Ohio released its latest COVID numbers, and just like many parts of the country, our uptick in cases is continuing.
All right, so we want to show you right now. Over the past week, the state reported a little more than 11,000 cases. That's up from last week. Our case rate also rising, almost 147 for every 100,000 people in the state. New hospitalizations and deaths are both slightly down, even though some doctors predict increases in both coming in weeks. So what does this all mean? News 5's Cameron Justice spent today working to get some answers.
Unfortunately, I tested positive yesterday afternoon. So of the 5 family members, 4 of us have pretty much were COVID positive.
Like thousands of other Ohioans right now, Marla Zwingy, one of the so-called vaccine queens, is dealing with this latest surge of COVID. After spending more than 2 years trying to avoid it,
We made it 781 days.
Zwingy and her family contracted the virus.
I'm just so thankful for the availability of vaccines, to know that I don't have the panic that I had last year prior to having the kids vaccinated. I know that we're going to be okay.
Zwingy said her family just recently began returning to a sense of normalcy.
In the last month, with the numbers going down, especially in Jaga County, we did let our guard down.
But with more than 11,000 new cases in Ohio this week, experts say cases like Zwingy's are something to expect moving forward.
Everywhere that was affected by Omicron and everywhere that they picked up the subvariant, there's also been a bump, whether it's a summer bump or a spring bump in cases, a slight surge.
But there is good news in all of this.
The good part about it is that they're not seeing the levels that we have right now, especially when it comes to hospitalizations, are still half of what they were in July 2021.
With hospitalizations and deaths in the state below the 3-week average, Lorain County Health Commissioner Mark Adams says he expects this trend to continue.
You're seeing infection in even people that were vaccinated, but they're having very mild illness if they have illness at all.
Dr. Hassan Cooley of the Cleveland Clinic adds that the current surge in cases, while serious, is something that should be expected for months, if not years to come.
I think what we're going to see peaks and valleys in terms of infections. We're going to continue actually to have to learn how to live with this infection.
Following best practices,
we know that when we need to social distancing and masking can prevent also some of these infections from happening and hospitalizations from occurring.
And reaching out to health officials with questions and concerns.
If you need a vaccine, give us a call. If you need anything, a mask, anything, give us a call.
While adjusting to a more normal way of life, like Zwingy is aiming to do.
Look at our own individual risks and say, okay, are we going to a crowded event? Do we feel like the risk is high or the risk is low? And I encourage everybody to talk to their doctors. But in terms of us, I think we just are going to live differently now. I mean, obviously the hand washing, but we can't be crazy. We still have to live our lives.
In Cleveland, Cameron Justice, News 5.
All right, thanks, Cameron. And since the start of the pandemic more than 2 years ago, more than 2.7 million Ohioans have gotten COVID. Sadly, more than 38,000 have died.